JG the PT, and I'm going to talk through one of our core 4, which is using the glove for glove work. Let's talk about the glove and why we would use it. As a PT and most clinicians, we're very tactile and we like to be very hands-on. So we like to feel what's going on. We like to feel the muscles. We like to feel the joint move. By using the glove, we can run the NeuBie current through our hands and actually use that current as a scanning process so we can have a little bit more of a diagnostic tool. But at the same time, we can use it as a treatment. So you're getting a 2-for-1 when you're using the glove. And I personally love it because I can use it diagnostically and then transition very quickly into a treatment within like 5 seconds. Using the glove is going to be very important when you're doing like an eval or you're trying to kind of figure out what's going on and you can get a global scan. What you're looking for is what we call hotspots, and those are areas of increased guarding. So when you hit one of those hotspots with the glove, you're looking for subjective feedback from your patient. Your patient is going to either like come away from you, or they're going to have a very strong facial expression reaction, or they're going to tell you or jump, or it might tickle. When we have an area of increased sensation, that means that the current that's running through that spot, your brain and your nervous system is going to pull away and send some sort of alert signal. So it's not always a pain response. We're not always looking for the glove to elicit pain. It's more of an intensity scale. So we're looking for that area of intensity where your patient's subjective response jumps from like a 5 out of 10 to maybe a 6, 7, or 8 out of 10. So we're really heavily relying on subjective feedback from the patient. When you're using the glove, you're not going to be able to feel it as a clinician. That's normal. You want the patient to feel everything. You want them to feel it more in the glove than they do on the ground. If they're feeling it on the ground more, you can either move that ground around, or we know that we really need to work on neural connection in that area for that specific patient. So when you're looking at treatment with the glove, I am wearing the glove as a clinician. The patient has the ground on them. So the loop is closed on the patient. What we're looking for those hot spots with the glove. And then it's really easy to do both sides. So you can pick an area of the body. You can do like the left shoulder. And then if you're curious of if that intensity is on the right side as well, you can just hop over to the other side. So it's really good for left to right comparison. And then it's really good if you're doing a global body scan. You can jump down to the lower extremity as well, or you can jump to the low back. It's a great way to scan the entire body, or if you're going for a specific body part, that whole region, and compare left versus right. You still want to do your special test or like before and after pre-test because you're going to elicit change with the glove. A really good time to use it is if people have chronic pain or chronic tension. So if they have really tight hypertonic muscles, it's a good way to relax the nervous system with this current. I feel like you'd use the glove like all the time. I typically describe the glove as a 3D massage. It feels really nice for patients, and it should be at a low enough intensity where it feels somewhat relaxing and calming. It shouldn't be too high where your patient is cringing or you're eliciting like a very, very high nervous response. So here's how we're gonna set it up. We're gonna take the glove and you're actually gonna get it wet. This is one of the most common questions we get is how wet do I get it? And do we need to re-wet it? The glove needs to be soaking wet so that you can wring it out. If you have patients that are hairy or just more dry and the glove dries out, you can re-wet it throughout your treatment. But just be mindful if the patient says it feels scratchy, that you might need to get it more wet. So the glove is gonna get wet first. Then you're gonna take your connector that the glove comes with and you're gonna attach it to the button. Then you're gonna take the glove and you're gonna attach it to the black cord on channel 1. So black cord comes in here, and then your red cord is gonna go to your ground, to a rectangle electrode here, and you're gonna place this somewhere on the patient. Typically, we like to ground on the low back. That way the pad stays out of the way and you can scan anywhere from there. If you're gonna go on the lower extremity, low back is a great place. If you're gonna go upper extremity, low back is great. If you want to scan the low back, you can just move the ground up to kind of more of that mid-thoracic. So our glove is set up on the black cord and our ground is on the red. And we're gonna take this ground, we're gonna peel this off, and we're gonna place the ground, go ahead and spin for me this way, right on the low back. So we're gonna take that right here, and tuck it in right there. It's out of the way. People always ask right hand, left hand, dominant versus non. It just depends on where you're working and what you're comfortable with. Depending on my patient, I like to be on the same side, so I'm not crisscrossing. Just watch your body positioning and your posture and make sure it's sufficient to you. So I'm gonna don the glove on my left hand. If I was working on her left shoulder, I will have my glove placed completely on her shoulder before I even turn it up. This way, you don't wanna have the glove off and then turn it up and then all of a sudden touch your patient, because that could send them a lot of current. So you're gonna keep a flat hand on your patient, and then you're gonna turn it up to the point where they feel first sensation. The biggest and most important thing about doing glove work is communication with your patient. Most people have questions of, well, it felt too intense, or I couldn't really figure out how to stay on the shoulder. It's a little bit of an art. You have to finagle, like if you're gonna use a flat hand versus 2 fingers. If I go to 3 fingers right here, I'm gonna send a lot of current just into that one spot. So if I keep a flat hand, that's gonna be a little bit better for the scanning process. But then if I wanna dig in, say to those upper traps, that's when I can take 2 fingers and do a little bit more specific and send a little bit more current in. So there is a way where you can manipulate the intensity of the current by changing the surface area through the glove. That's a little bit of an art, and you'll get it as you keep practicing. But just be mindful that if you're going from a flat hand to a few fingers, you're gonna have a big increase in intensity in the current. So going over the 3 most important things, the glove has to be wet. You really need to watch your surface area and your fingers. And then it can be used for a diagnostic tool and for a treatment tool. Another fun thing to do with the glove is if you have your patient, you can be scanning and find like an area of a hot spot, and then you can use your other hand to facilitate movement. So say I found a hot spot on those pecs, I wanna stay in here, I can actually use my other hand and kind of take her back into a pec release. So I can go through like a pin and stretch. I can kind of come into those lats, and then I can have her actively bring her arm up. So go ahead and actively bring your hand over your head. So we can do active range of motion. We can do passive range of motion. Go ahead and relax. We can even do isometric holds when we reprogram a muscle. I can come back to somewhere on the rotator cuff and hold here, and then have her go through some active internal and external rotation if I'm trying to target more of that activation in a muscle. I'm JG the PT, and that was our take on glove work with the NEUBIE. If that was helpful, follow along for more tips and send this to somebody who would benefit from some glove work.